I'm Amar. I'm a clinician, a forensic psychiatrist by background, and the Chief Quality Officer at East London NHS Foundation Trust, which is a healthcare system in England delivering mental health, primary care and community health services to a population of about 1.7 million people. We've been on an improvement journey for about the last 10 or 12 years now. And as part of that, one of the elements is really about thinking about how we better use the data we have to be able to support our efforts to keep improving the care we provide and the outcomes we're able to deliver for our local populations. One of the early steps we made in this was thinking as a board, how do we best use the information that comes to us in order to make decisions and in order to understand the quality of care that's being provided. And we, about 10 years ago, shifted from tables of data and RAG rating scorecards towards a set of whole system measures, which we started to look at consistently every board meeting and being able to see the difference we were making over time. We started to do that manually at first, just starting from very simple line charts that we created manually in Excel, but very quickly moved on from that to run charts and control charts, which gives us much more specificity about when is something unusual happening that we need to pay attention to, and when is something stable and in control that we don't need to pay attention to if it's delivering what we want it to. So we started to move towards control charts at the board, and it's made a really big difference in guiding our conversation towards the places where we really needed to focus our attention as a board, and the places where we were also seeing improvement on the back of the efforts of our staff and service users to improve the system. What we realized was that we couldn't just make that change at the board, though. We needed to also think about how each of our teams, and we have over 300 teams, could also look at their data in a way that gives them an understanding of variation so they can see how they're doing, where they're doing well, where they're not doing so well, where things are improving, where they're not improving, and where they need to focus. And obviously, when you think about the complexity of data in healthcare, where we have data coming from so many different sources, clinical systems, but also non-clinical systems, HR systems, finance systems, safety systems, we need to think about a way to integrate that and make that available to our staff in a simple way that they can view their data in one place in a consistent way over time. And that's when we got a bit stuck, because there wasn't anything out there in the market that would enable us to do that. So we partnered and developed EasySPC with BCN, and we have now found a way to integrate the EasySPC tool into Power BI so that each of our teams can access their data in a single place in Power BI, which gives them access to their data from a computer, from a laptop, from a mobile or a tablet, wherever they are, but also to be able to see that in a way that helps them look at data over time using control charts. And now our staff, 10 years on, having learned about quality improvement, are very familiar with looking at data in this way, so they can spot very quickly when something needs to be paid attention to or when something is moving in the right direction or the wrong direction. Obviously, this is now quite a sophisticated tool because it takes data from thousands of different sources and lots of different measures and brings it together into a single platform, all visualized together. And our teams have found that super helpful. They've now got a single place where they can look at their data in a consistent way. And we're starting to move beyond just looking at data that we already hold and starting to think a little bit more in an advanced way about predictive analytics. Some of the new things we're building give our teams ways to be able to spot problems even before they occur using things like early warning systems. So it's been a real journey and evolution for us in our organization about shifting the way we use data from static data, looking at just assurance style reports, whether we're meeting a target or not, to actually looking at data in a consistent way. Whether you're a team, whether you're a divisional director, or whether you're the whole trust or organization level data, we look at it in the same way now. And we're able to make decisions based on a good understanding of the variation, which statistical process control charts, or control charts as we use them, give us now in much more detail. So it's been a really exciting journey to be on, and we've been proud to partner with BCN in this work. They brought a lot of capability and technology that we couldn't have done by ourselves. And we're really proud to have developed the EasySPC tool, which is now being used all around the world by organizations who want to bring all of their data to their teams in a simple to use way, which allows them to access all of the additional functionality that control charts gives you when you're trying to make sense of whether your system or your team is improving the care it's delivering or not.